Reactive attachment disorder is defined as markedly disturbed and developmentally inappropriate social activity before the age of 5 years. This can be either persistent failure to initiate or respond to social interactions or excessive familiarity with strangers.
Why won't it shut up?
I know, just shake it. It'll shut up then.
Hey, don't do it to the baby! Gosh, stop crying! I can't stand this! Ugh, come on!
So I read in this book that if you let a baby cry, then it'll basically teach itself not to cry anymore. But it's been 3 days and he hasn't stopped crying yet. I really don't know what to do. It's really irritating.
Children with reactive attachment disorder may seem withdrawn or sad.
They won't smile at you or reach for you when they're picked up.
They're calmer when they're left alone, so they won't like playing peekaboo or patty cake.
These children will avoid or ignore any comforting gestures or comments.
As students, they won't ask for help. As classmates, they won't join in games and may become aggressive towards other classmates.
Teenagers with RAD will start to hide their anger. They may start to form an alcohol or drug abuse problem.
People with RAD develop either inhibited behavior or disinhibited behavior.
Inhibited behavior is when a child is probably neglected and they push away from anyone that can give care to them. Disinhibited behavior is when a child has too many caregivers and they seek attention from everyone.
1 in 100 children are diagnosed with reactive attachment disorder. Take your child to see a doctor if you notice any of these symptoms.
I knew something wasn't right early on. We adopted Julia from a Siberian orphanage in February 2003. She didn't clutch to me or gaze in my eye. She never rested her head on my shoulder or relaxed into a warm embrace. She didn't respond if I sang or read to her. She was there, but wasn't.
Factors that may increase the likelihood of getting RAD are living in an orphanage, hospital, or institution for an extended period of time, frequent changes in caregivers, inexperienced, mentally ill, abusive, or neglectful parents, abuse of any kind, and alcoholic or depressed parents. Because these factors themselves are hard to do research on, since no one would leave a child in an unhealthy situation to do research on the child, the diagnosis and treatment of RAD is a controversial issue. This issue is amplified by the fact that there is not a universally accepted way of diagnosing a child with reactive attachment disorder.
Reactive attachment disorder is a lifelong condition, but with treatment, children can develop more stable and healthy relationships. In fact, some treatments for reactive attachment disorder include psychological counseling or parent or caregiver education.
Many students with reactive attachment disorder live by the idea that having the teacher's attention means that you are in control of the classroom and these students crave control. They tend to use negative methods to gain attention because negative attention is more energetic and exciting than positive attention. Some important things to keep in mind are to never lose your temper with the child and provide an extremely structured classroom environment so the child will know what is expected of him.
Some adaptations for teachers trying to help students with reactive attachment disorder are providing the child with choices on assignments so that they can feel in control, providing clear classroom rules that state the consequences for the inappropriate behaviors, and communicating directly, positively, and firmly while maintaining eye contact.
Teachers of students with RAD have to remember that these students do not do well with inconsistency and consequences or timeouts. It is better to make the child stand with you and have a time in. These teachers should never raise their voices or lose their tempers because that just gives control of the classroom to the child with RAD.
Reactive attachment disorder is difficult to treat, so prevention is by far the best option. We need to work hard as possible as new mothers to
to understand the importance of forming a bond with our children. This is my son, Malik. He was shaken by his daycare provider when he was 4 months old.